All right, hey guys. This is Andrea, James, and Sam, and we are presenting on the Balanced Budget Act of 1997 and the therapy cap. Next slide, please. The Balanced Budget Act was the largest reduction in federal Medicare spending, Medicaid, excuse me, since 1981. So about 15 years. And the goal of this was to reduce post-acute care spending. Um, and it was really putting an emphasis on slowing down the Medicare spending as a whole and extending the life of the Medicare trust fund because Medicare was losing more money than they were taking in. This allows states to require most Medicaid beneficiaries to enroll in managed care organizations, which is basically businesses that are contracted by Medicaid and they just do business with Medicaid. And before that had to be done with a waiver. And so it allowed a little bit more freedom with that. And it also limited the number of those Medicare based organizations. And then also it eliminated the minimum payment standards for reimbursement.
All right, so how did the law affect PTs and healthcare providers? So with Medicare spending, specifically home health, rising from $2.8 billion in 1989 to $11.8 billion in 1997, the goal for the Balanced Budget Act was to reduce Medicaid spending by capping the reimbursement expenditure a patient could receive to $1,500 yearly. It is currently set to $2,010. Physical therapy and speech language pathology have a combined cap, and occupational therapy has a separate cap, meaning patients can receive PT and OT in the same year without caps interfering with each other. With the passing of the Balanced Budget Act, physical therapists and other healthcare providers were now unable to treat patients once those caps were hit, decreasing the amount of service able to be provided. Many clinicians quickly lobbied for and passed exception and exemption laws, which allowed patients that met certain requirements to receive treatment beyond the set caps. These laws were usually short-lasted, though, and needed constant attention from across the country to update existing or pass new laws. It wasn't until 2018 when an exception law became permanent for the continuation of treatment past the cap for qualified patients. A nationally representative study published in 2008 examined the amount of PT, OT, and SLP services used from 1995, 2 years before the Act, and 2001, 4 years after the Act, and found services provided in all settings had actually slightly increased, aside from inpatient rehabilitation services, which had a slight decrease.
So, like we said before, the mandate limits Medicare benefits, allowing for a total of only $1,500 per patient when it was first passed per year for outpatient physical therapy and separate speech pathology treatments combined. So, for a real life scenario, it would require seniors to pay for a substantial portion of rehabilitation treatments out of their own pockets and leave them without medical coverage for additional injuries sustained in the same year unless they go to the hospital. So the government was basically telling individuals over 65 that they have to accept a secondary lifestyle of dependency. So, for example, we have Bob here on the bottom right corner, and he is an elderly man with a history of having frequent strokes, and he requires both physical therapy and speech or language treatments. And with this law in place, or like when it was first passed in 1997, he would have to have chosen between speaking or walking because on average, stroke patients require physical therapy about 3 times a week for a period of 6 weeks immediately after an incident. And most actually require additional treatment 6 to 8 weeks later. And if the average cost of a visit is about $82, the 1,500 cap would barely even cover half the cost of necessary treatment. So Bob would also be left with no funds for extended treatment or costs related to additional illnesses and injuries that could occur in the same year.
We made a couple of quiz questions here. So going through them, what year did a permanent exception law pass for the continuation of treatment and coverage for qualified patients after the reimbursement cap is met? Next question, Medicaid home health care spending rose from 2.8 billion in 1989 to how much in 1997, which contributed to the passing of the Balanced Budget Act. Medicaid reimbursement caps are currently set for $2,010 yearly for which of these services? And the answers, and that completes our presentation with our references.